Pharmacology of appetite stimulant drugs. Physiology of hunger and appetite. Hunger and appetite are controlled by complex interactions between the central nervous system, CNS, gastrointestinal tract, and hormones. Hunger is a physiological drive to consume food, regulated mainly by the hypothalamus. Appetite is a psychological desire for food, influenced by sensory inputs, emotions, and environmental factors. Key hormones involved in appetite regulation. Ghrelin, a hormone released by the stomach that stimulates hunger by acting on the hypothalamus. Leptin, a hormone secreted by adipose tissue that suppresses appetite by inhibiting hypothalamic hunger centers. Serotonin and dopamine, neurotransmitters that modulate appetite. Serotonin generally reduces appetite, while dopamine enhances the reward of eating. Neuropeptide Y, NPY, and agutyrylated peptide, AGRP, stimulate hunger and food intake. Melanocortins, alpha-MSH, suppress appetite by acting on melanocortin receptors. Mechanism of action of appetite stimulant drugs. Appetite stimulants enhance food intake by targeting various pathways in appetite regulation, antagonizing serotonin, 5-HT2, receptors to reduce satiety signaling, e.g., cyproheptadine, enhancing GABAergic activity to promote feeding behavior, e.g., benzodiazepines, increasing ghrelin-like activity to stimulate hunger, e.g., caprimorelin, inhibiting dopamine and norepinephrine uptake to increase appetite drive, e.g., mirtazapine. Common appetite stimulant drugs and their pharmacology. 1. Cyproheptadine. Mechanism, antihistamine, H1 receptor antagonist, and serotonin, 5-HT2, antagonist, reducing satiety signals in the hypothalamus. Clinical uses, appetite stimulation in cats, dogs, and horses, also used for allergic conditions. Side effects, sedation, dry mouth, increased thirst, potential paradoxical excitement. Precautions, use cautiously in animals with liver disease or urinary retention. 2. Mirtazapine. Mechanism, antagonizes serotonin, 5-HT2, 5-HT3, and histamine, H1, receptors, while enhancing norepinephrine release. Clinical uses, appetite stimulation in cats and dogs, anti-nausea properties. Side effects, drowsiness, increased vocalization, especially in cats, tachycardia. Precautions, adjust dose in renal failure, avoid use with monoamine oxidase inhibitors, MAOIs. 3. Caprimorelin, entice. Mechanism, ghrelin receptor agonist, mimicking ghrelin to stimulate appetite. Clinical uses, FDA-approved appetite stimulant for dogs and cats. Side effects, vomiting, diarrhea, hypersalivation. Precautions, use with caution in patients with liver or kidney disease. 4. Benzodiazepines, diazepam, oxazepam. Mechanism, enhances GABAergic activity, reducing anxiety and stimulating feeding behavior. Clinical uses, appetite stimulant in cats, also used as an anxiolytic and anticonvulsant. Side effects, sedation, ataxia, paradoxical excitement. Precautions, avoid prolonged use due to potential hepatotoxicity in cats.